Morning.
Thank you for joining us on our latest monthly webinar, which is seating for the older adult. So we're going to have a look at the various postural challenges associated with that client group. My name is Les Jones and I'm joined today by Rebecca.
Good morning. I am clinical specialist, physiotherapist by background.
Just a little bit of housekeeping. I can see some of you still got your cameras on. So just to let you know that we are recording the session. So if your camera's on, you're on it for good. So please make sure your camera and your mics are switched off. Our colleague Kim is in the background. If you have any queries or any issues, or if Rebecca mentions a link, Kim will post that on the chat feature. If I leave Rebecca to wander off to load up the presentation. Fault finding, if you have an issue with the connection, if you just try to log in and log out, that seems to work. If the issue could persist, just post something and we'll see if Kim can help you out. I think that's it for a little while. So we're going to start with a little bit of a PowerPoint. We'll come back to do a little case study towards the end. And I'll pass you over to Rebecca.
Thank you, Les. Just say, obviously, we've only got kind of 45 minutes, an hour together. We've got a lot of information to get through. Where of course we'll be sharing the recording of the presentation of the webinar, but we'll give you the slides as well. So if there's any kind of terminology that I mention, or if you want anything for us to expand on, then use the chat function and we can make a note of it and send it out when we send all the information out. What we'll do then, as Les said, is have a look at the chairs, relate that to some of the postural challenges that we talk about in the theory. We'll have a bit of a Q&A then as well. So if anything pops up or anything client related you want to ask about, we'll have some time at the end to do that as well. Let's get the presentation on the screen. And hopefully, brilliant. Okay. So welcome to our presentation on seating for older adults, addressing those age-related postural challenges. We'll have a look about the impact of aging on posture, review the importance of postural care, and then link that to the seating provision. Also finish with some slides on how at CareFlex we can help as well. Those of you who already work with us might not be aware of some of the new publications that we have out, and those of you that are new to us today, some info, maybe some of the training events we can offer, assessments and prescription, and so on. Okay, the term older person can be used to describe an individual aged 65 and over, and there are over 11.9 million older people in the UK. So what we're seeing now with ongoing advances in technology, changes in healthcare and lifestyles, people in the UK are living longer than they might have in years gone by. So in 2017, 18.2% of the UK population were aged 65 and over, which is around 1 in 5 people. And obviously this proportion is projected to increase by a further 5.8% by 2037, which will then take it to 1 in 4 people aged 65 and over. Now, inevitably, with age comes an increased risk of illness and disability. And there's an estimated 4 million older people in the UK who live with a limiting long-standing condition, so those chronic conditions, which equates to over 40% of people aged 65 and over. The prevalence rate of dementia among older people is estimated to be around 7%. Frailty becomes more prevalent with age too, and affects around 10% of those aged 65. And when we then work with individuals aged over 90, it's around 65% who would present with frailty. Now, when we think about how posture is affected specifically by age, what we can see with that type of client group is them experiencing inactivity, generalized weakness, and that's with or without an associated illness or disability. Frailty, which as we know was characterized by a progressive decline in physical, mental and or social functions, can significantly exacerbate those problems. And then what we can see is poor postural control, pelvic instability as gravity takes hold, And then those gravitational forces can trap them in destructive postures, which further exaggerates these asymmetries and can lead to unequal loading on the tissues. What we might see, I'll show you some images later, is the slumping in the chair, the head rolling forward, and so on. So it's this vicious cycle of getting trapped in these destructive postures. Now, posture is directly related to a person's health, well-being, and quality of life. There are physical, psychological, and emotional effects of body shape distortion, and poor postural care can have severe and life-threatening consequences. Some of the physical impacts that we might see, so if we're working with the older person who doesn't have that effective postural care in place, some of the physical impacts we might see include pain, fatigue, we could see deformities such as contractures, respiratory problems, recurrent infections, digestive issues, constipation, choking hazards with safe eating and drinking, increased risk of pressure injuries. Those comorbidities might lead to polypharmacy and sadly even premature death. This inability to maintain an upright sitting posture is associated with a decline in health. And then what we might see, as we mentioned, things like recurrent infections, choking incidents, aspirations, digestive problems, and pressure injuries. The psychosocial impacts can include isolation, dependency, inaccessibility, low mood, and low confidence. So individuals might become trapped to the four walls of their bedroom and lack that interaction and engagement. Now, loneliness and isolation have been found to be twice as harmful as obesity is to physical and mental health, which is quite shocking. Now, we talk about proactive postural care, and what we mean by this is, even though there's this myth going around, body distortion is not inevitable. So if we have the right equipment that's provided at the right time, so that proactive care, positioning techniques can help to protect body shape. And that's why we need to be proactive. We need to identify risk before we see those really complex postures and reduce the risk of those happening. There are going to be clear benefits to health, well-being, and quality of life. As I mentioned, we've got a lot to get through, so we do have lots of publications out there, clinical justifications for each of the chairs, just to really emphasise those clear benefits and give you some evidence base to back that up. They are available on the website as well for each of the chairs, so you can download those clinical justifications, and maybe Kim can kind of signpost you in the right direction for those, just so you have that evidence base and can back up with research and with publications and with white papers and so on of those clear benefits to quality of life. What we can do with proactive postural care is actually reduce the need for unnecessary interventions. When we think about intensive, invasive and expensive interventions like surgery, increased packages of care and reducing the need for those, which in turn will ensure cost effectiveness. And this isn't just about the service provision, this is about the human cost as well. And ultimately, what we want to do is promote longevity. Postural care is a key preventative measure to reduce the risk of those serious secondary complications. So when we talk about proactive, we need to be proactive with identifying risk as well. So who exactly needs postural care? And we can break this down into 4 different categories. Those who, of course, lack the physical ability to be able to change their position independently. Those who lack the cognitive awareness to know that they need to change position, especially in the older adults, maybe those who have a diagnosis of dementia, who lack that cognitive awareness to know where they are and to know that they may maybe been sitting down in the same position for the last 8 hours. Those who lack the communication skills, so they know that they're uncomfortable, but they can't relay that information to anyone. But then also those who lack the sensory feedback, especially when it comes to proprioceptive feedback and not knowing that they may be uncomfortable, not knowing that they're sitting in asymmetrical positions, that there's increased pressure going through one part of the body and reducing blood flow. So those are the 4 areas to focus on. It's not just about waiting for those with complex presentations in front of us. It's about identifying those who are at risk of those things happening. And it's not just the physical concerns. We need to think about the cognitive effects and the communication and the sensory aspects as well. Now, the body structure itself distorts due to various different things. So, of course, we've got that inability to change position, which then can lead to asymmetrical positioning. We've then got the influence of gravitational forces, which then exaggerate those symmetries. And what that actually means visually, I touched on this earlier, but what we might see is the generalized weakness. It's really difficult to hold ourselves up erect against gravity. If I asked you to stay in one position for the next 8 hours, you'd soon start feeling those unrelenting forces. And we don't have those damaged to our body systems that already makes it hard as it is. So thinking about trunk stability, generalized weakness, fatigue management, and actually how tiring it is to sit for prolonged periods of time. And what we can see then is the slumping within the chair, the head rolling, the asymmetrical positioning then. So on the right side of the pelvis, you can see that obliquity happening, increased pressure then going through one part of the pelvis, increasing the risk of pressure injuries because of that unequal loading on tissues. But then also the psychosocial aspects that we mentioned. So when somebody's fatigued, that lack of interaction and engagement, thinking about their well-being and mood as well, and how that impacts on their ability to interact with the outside world. So when we think about those age-related postural challenges, this is what we're going to focus on today. We're going to run through these, the theory behind them, some of the things to be aware of, some risk factors to be mindful of, and then what we'll do is introduce a case study and relate this to the seating provision itself, and discuss some of those seating solutions that can help. Now, destructive postures, whether that's for prolonged periods of time or not, can cause tension on the body and increase the risk of significant pain. Now, research has shown that proper positioning is imperative in order to promote that much needed comfort. Supportive sitting postures can also be effective when we think about abnormal tonal changes as well, and maybe spasticity and the pain that's associated with that. Being comfortable and feeling safe can increase that person's tolerance of that seated position as well. So ultimately, compliance with that piece of equipment. If an individual isn't comfortable, then they simply won't use that chair regardless of the clinical benefits that we are trying to get across to them. We've got fatigue. Fatigue can affect all aspects of an individual's life and significantly restrict their ability to engage in daily living, as well, of course, those negative impacts on psychological function and social functions as well. Unsupported postures cause fatigue by making inefficient use of the body structure and segments. So when we talk about postural care, those of you who've been to our webinars before, when we talk about the individual body segments, the pelvis, the head, the spine, the lower legs, feet, and so on, fatigue essentially happens because we're not using that body structure efficiently, because maybe we're having to focus on things like our trunk alignment, because we have generalized weakness, because we have tonal changes that are causing pain. We can't focus on that stability and support in sitting. Gravitational forces then, as we know, make sitting effortful for those who prevent with muscle weakness and abnormal muscle tone. The problem with fatigue is that it's often associated with significant postural challenges, especially if that posture becomes unmanaged. Things like increased thoracic kyphosis, pelvic instability, and fixed deformities. When we talk about fatigue, we can see an impact on their function and independence as well. As we know, independence is crucial for well-being and is an important factor in living a fulfilling life. So we need to encourage that through energy management. Functional movement is also really important for protecting the body structure and reducing the risk of injury as well. So by getting blood flow to the area, by taking joint through ranges of movement to try and protect that body structure. If a person is low on energy, then of course function and independence can become extremely difficult. what we can see then is this inability to sit down comfortably and efficiently. And we see that individual being confined to their bed. The four walls of their bedroom becomes their world, those limited opportunities for socialising. Now, research has shown if we have that stable, supportive posture, we can encourage participation, whether that's in social activities at home, school, work, and even as part of the community. Introduction of seating systems at the appropriate time. So again, going back to that proactive postural care can facilitate that psychosocial and cognitive development, especially when we're working with individuals maybe with dementia or those with intellectual disabilities. That upright sitting position will offer a better line of vision for interaction and provide this increased ability to achieve cognitive tasks. So we think about that image of that lady where gravity has taken hold and the eye gaze is suddenly down to the floor. We get that rounding of the shoulders and the posture. It can be extremely difficult for her to extend and lift her head up to be able to engage. So we need that supportive posture to be able to get good communication with people. What we'll do when we have a look at the case studies, maybe give you some ideas about different chair functions that can specifically help with fatigue management, things like tilt in space and back angle recline, but we'll go through on a bit more detail when you actually see the chairs. Next, we have that pelvic instability, and specifically with the older adult, what we might see is a posterior pelvic tilt. So we'll see the pelvis rolling backwards, otherwise called sacral sitting. So the ASISs at the front become higher than the PSISs. There are going to be intrinsic causes to this, things like limited hip flexion, tight hamstrings pulling them into that position, and weak abdominals, so they fall in again, quite common with that generalized weakness, and even fatigue as well, because it's difficult to maintain that erect midline position. A posterior pelvic tilt can be associated with other significant postural challenges as well, which we will be discussing next. Things like this thoracic kyphosis. But we can also see in the image there, this cervical spine hyperextension, because we're trying to maintain that functional visual field. There might be a tendency to slide forward in the seat, risk of falling out of the chair, and increased pressure injuries over the sacrum and the apex of that kyphotic spine as well. There are going to be some changes within the chair as well. So even if somebody doesn't have any internal causes for any damage to their body systems that could be produced in that posterior pelvic tilt, something as basic as the chair setup can actually cause a posterior pelvic tilt, especially those of you who might work in multi-user environments where we have a 6-foot individual and a 5-foot individual using the same piece of equipment. We need to be mindful of that chair setup. Things like the seat height being too high, the seat depth being too long, lack of adequate foot support. So if we see foot plates being used as door stops and bookends, if we're not mindful of the back angle to the hip range of movement, and even inappropriate use of the elevated leg rest can pull people into that posterior tilt. So otherwise, they might have had no damage to the body systems, good range of movement. Something as basic as a chair setup can cause that posterior tilt and cause those significant postural challenges. And again, when we have a look at the case study, Les can show you some of those, how easy it is really to set up the chair around the individual, but just being mindful of making sure that we tailor that provision to each individual who's using the chair. There are other things that can help with the posterior pelvic tilt as well, and the management will depend on whether that is correctable or if it's fixed. So that postural assessment is really key, coming to us with that problem list and working collaboratively with the seating assessor to come up with a seating solution, because it depends as well in what planes of movement some of those restrictions are. But things like ramped bases, tilt in space, even pelvic belts such as positioning aids to stabilise the pelvis might be indicated. But we'll have a look at those seating solutions in a bit more detail. We also have in this client group, what we might see is an increased thoracic kyphosis, where the individual will present with this increased curvature of the thoracic region, and it results in the top of the back appearing more rounded than normal. of course, these curves are normal. This S shape to the spine is normal. It's when that curve becomes excessive that we need to be worried, especially when we then start seeing changes to the head position. Again, it can be associated with other postural challenges, such as that pelvic tilt. What we might also see is a scoliosis, where we get that lateral flexion, the lateral curve to the spine, an increased risk of pressure injuries through the apex of the spine, but also the sacrum and heels as well, as we see that posterior pelvic tilt happening. One of the big problems with an increased thoracic kyphosis, especially in the older adult, is then presenting with physiological dysfunction, and we might see issues with respiration and digestive problems. We need to be mindful of safe eating and drinking, because we might see dysphagia or swallowing difficulties because they're unable to achieve that safe position of the head and the neck for safe eating and drinking. That head position as well can also result in their line of vision being towards the floor, and as we know, will have a significant impact on interaction and engagement. Different seating solutions as well, depending on whether this is a fixed or correctable posture. And that's something we always have to ascertain when we do our postural assessments, how correctable is something, because that will depend whether we accommodate or whether we can correct. And it's really key that the seating assessors know how far, I guess, we can push the body structure and the body segments, or what we need to accommodate. So we can't correct, we still need to accommodate to make sure it doesn't get any worse. Anterior support can be really helpful for a thoracic kyphosis. Sometimes the force from the front can help, especially by opening up the shoulder girdle. And if people don't respond well to tilt in space, or if tilt in space isn't suitable because of dysphagia, then we might need to get that anterior support instead of that posterior tilt. Sometimes using a tray with pillows to prop can be helpful as well to open up the shoulder girdle. If we are working with individuals who have fixed thoracic kyphosis, then we may then be going up in complexity in terms of the chair to things like an articulating headrest, and making sure we have profiled head support to fill in those gaps essentially. But again, Les can show you some of those options, and you can see those in action. With a thoracic kyphosis, we need to be mindful of the chair setup again, making sure that we have the correct seat depth, seat width, and armrest height. So we've got adequate trunk support and adequate head support. So again, all these basics, which sadly often are overlooked. If we are working with complex presentations, we still need to take a step back, go right back to the basics of chair setup and chair dimensions before we then build on that. Especially as part of the review process, if you're getting re-referrals back in with chairs not working, or getting complaints about certain aspects of seating not being appropriate anymore, then always check those basics, go back to the chair basics, especially maybe in multi-user environments or where family concerned and they're not really aware of the chair setup, and maybe fiddling with some of the controls, changing the angle of the back. So this is just a helpful tip there. If you are having trouble, go right back to the basics of the chair set. We have contractures next, specifically things like wind sweeping or knee contractures. And you can see the image there of my lovely sister's legs modeling for me. Windswept deformity, so you get the abduction and external rotation of one hip with the adduction and internal rotation of the other. However, windsweeping is always a whole body system postural challenge, because it can be associated with pelvic obliquity, with a scoliosis, pelvic rotation, with a spinal rotation, and even a posterior pelvic tilt. So it's not just about addressing those lower limbs. We have to understand the impact that it has on the pelvis and on the spine, especially if it's a fixed wind sweeping, because if we go in and try and correct, all we see is further rotation of the pelvis and the spine, or we might see a further obliquity happening. So sometimes we might need to accommodate this wind sweeping if we can't correct it. And manage what we can see is increased pressure injury risk, especially in the groin region, and overall postural deterioration and the physiological dysfunction that comes with that. Again, different seating solutions that we can run through when we see the chairs in action, but things like pommels, contoured seating to encourage that pelvic stability and optimum thigh alignment, building then up to channeled or W trough leg rests to maintain that alignment. But then also when we think about the chair setup, making sure that the back angle suits the hip range of movement, and that the leg rest accommodates any associated knee contractures. So when we think about knee contractures, this fixed positioning at the knees, so where an individual maybe has had some neurological involvement, or maybe they've had prolonged destructive positioning, going into a fetal position at night, maybe their nighttime position hasn't been addressed, and they're going into this flex fetal position for 12 hours at night. How are we then expecting them to extend out into this sitting position? And what we can see with this, sadly, is irreversible changes. So we start seeing changes to the soft tissue, shortening of those tendons and ligaments, and then sadly bony changes as well, which is then when it becomes those contractures and those irreversible changes. And you can see one of the seating solutions there in terms of accommodating and correcting. So we're able to accommodate on one side, correct on the other, and making sure that we are considering all those individual body segments to reduce the risk of worsening deterioration. Again, back to the chair setup and the importance of the actual dimensions of the chair. When we think about the angles of all the different functions, really important that the leg rest, especially when it comes to contractures of the knee, leg rest elevation isn't always going to be suitable. In some cases, we might even need a negative angle leg rest, especially with very tight contractures. And what we'll see with individuals, and maybe we can demonstrate it, I'll be Les's model. We can demonstrate actually if somebody has reduced knee range movement and we go to extend the leg rest, all we're going to do is pull them uncomfortably. It's going to cause a lot of pain, but it's going to pull them into that posterior pelvic tilt as well. And we're going to see a whole host of all these significant postural challenges happening just because the leg rest elevation wasn't suitable and that wasn't clear in the care plan or communicated and forwarded on to the care team and the support network. Then we have falls. So what we can see with reduced postural control is individuals at risk of sliding out of the chair or falling during transfers. So generalized weakness from immobility and inactivity can produce this deconditioning, which can also further increase that risk of falls. When it comes to the human cost, we're thinking about distress, injury, of course, loss of confidence, so the lack of that motivation then to want to keep active. We can see increased morbidity because of that inactivity, and sadly, mortality rates increasing. Staying active can not only improve their health, but also their cognition, the confidence and mood as well. So when we think about falls, prevention, an increase in mobility, the pelvis needs to be stable within the chair, feet adequately supported to enhance those feelings of security and help keep the user in the chair. But then also thinking about their transfers and how to encourage that independence as well with transfers, so they're an active participant in daily life. But remember that success of the sitting posture will only be as good as that initial positioning. So again, thinking about that care plan, taking images where possible, because a picture gives 1,000 words, especially when we think about the setup of the chair and that initial positioning to make sure that they're sat to their optimum within the chair before that even starts. Specialist equipment should also encourage any skills related to activity, as we know, whilst promoting safety. And then last, we have an increased risk of pressure injuries in this client group as well. So posture, arm pressure are inextricably linked, as we know. The body can only withstand these high interface pressures for very short periods of time. And when the loading of tissues is unequal, like we've seen with the effect of gravity, and all that pressure isn't regularly redistributed, that's when pressure ulcers can happen. And when they do happen, they have profound impact on overall well-being and can be both painful and debilitating. And sadly, in the older person, pressure injuries are associated with a 5-fold increase in mortality, which is just staggering. And the issue with this is that prolonged rest and immobility. So that feeds into then mobility and falls prevention. their engagement and trying to increase those activity levels, trying to promote independence and trying to keep people as active and as safe for as long as possible. When we talk about pressure care, appropriate management, or better still, prevention, is believed that around 98% of pressure injuries are preventable, will ultimately improve their quality of life. And a key intervention for this is repositioning. And we can use the seating system to regularly redistribute pressure and achieve different positions throughout the 24 hours, but making sure that we address that within the care plan. So we talk about postural care a lot, and I know we're focusing on seating today, but ultimately when we talk about postural care and pressure care, it's a 24-hour approach and how that chair plays a role, especially with individuals who maybe have wheelchairs or other support surfaces, using the bed as well, if that's appropriate during the day to achieve a change of position, and how we differentiate between those bits of equipment to achieve different postures, because that's about that regular redistribution of pressure and putting the body segments through different positions, because it's believed to be one of the most effective methods for preventing skin damage. And again, when we have a look through the chairs, Les can just briefly discuss water cell technology with you and some of the different options for those at a higher risk of pressure injury, maybe the use of contoured cushions and dynamic support and so on. So when we think about the older person, then just to recap, our main seating objectives, I mean, comfort is always a key here at CareFlex, because we know it ultimately informs compliance with equipment, and we're not going to achieve our clinical benefits if a user doesn't want to use that piece of equipment. So comfort is always the priority. We then have energy management and making sure that we use the chair to be able to offer periods of rest and recuperation before then coming back upright, for example, for engagement in daily life and activities. We, of course, need postural support at all body segments, encouraging function and independence, especially with interaction and engagement. And again, I know we've got a lot of OTs joining us, I know there's probably a lot that you can teach me around this as well, but making sure the seating enables that. So it's not just about achieving this perfect posture, which is strange coming from a physio, but it's actually about thinking of how that chair encourages activity. If individuals are not stable within the chair, we might see them clinging onto the arms of the chair or digging elbows into the corners of the chair, and suddenly we don't have movement in the upper limbs. We suddenly they become this load-bearing role, and we haven't got this active movement to engage in activities. We want to free those upper limbs, but we also will need to be safe, especially when we think about transfers and keep people safe within the chair. And then, of course, pressure care and how that feeds into postural care. So those are our main seating objectives for the older adult when we're addressing those age-related postural challenges. When we talk about good sitting posture, those of you who have an interest in postural care and those of you who have been to our webinars before will no doubt have seen this handy checklist from Pope that just goes through what we ideally want to see, the optimum positioning within the chair, with the body being conformed as symmetrically as possible to the support surface, body weight distributed as equally as possible, balanced and stabilized, but still able to adjust to change, so still able to reach outside of the base of support for activity whilst remaining safe within the chair. Thinking about those body segments, even the feet, because they take 90% of our body weight in sitting, but then the upper limbs being free from that load-bearing role for function. And then ideally what we want to see is, of course, the effects of gravity being addressed and the body supported within the chair, corrected where possible, but if we can't correct, accommodate. When we think about the older person as well, I just wanted to touch briefly on considering the caregiver, because we often rely maybe on family members, on loved ones, on professional carers within nursing homes or residential homes to be involved in their seating prescription. And this is where it's really key that we have a strong care plan. identifying key individuals who take responsibility for that care plan, and making sure that there are risk factors on the care plan so that they know when to contact you if they have concerns about posture. We can't be there 24/7 to follow up and review. I appreciate that, but at least giving individuals checkpoints or risk factors to look out for, so they know when the seating, maybe when needs have changed, or when the seating is no longer appropriate, or whether there needs to be some tweaks or some modifications to the chair. They're at the front line of providing support and will know firsthand what works and, more importantly, what doesn't work, especially with communication as well, and how they might communicate pain or comfort to you. What this does is maybe introduce some gaps in awareness with knowledge and skills. There might be a need for theoretical and practical training. When we think about the competencies and confidence, with the care plan, again, CareFlex are here to support that. If you have individuals where you are concerned about the support network, if there are training needs, then reach out to us and we can support that. If there's smaller groups to help with, if that means developing some publications, some easy read formats, some simple checklists for individuals to go along with the chair, then please let us know. It might be bigger training events in nursing homes and care homes. So please do let us know, and maybe Kim can give you the link there for the email address to get in touch with us. It's some more educational resources there. I don't think we touched on it at the start, but the website is a whole hub of information on there. All the different publications that we've produced over the years, clinical evaluations, justifications for each of the chairs. We've got the pocketbook of seating for reference out in the field, case studies. So again, take a look at that info centre. And if there's any particular thing you want sent out, even if it's in PDF format, so you can annotate and take it out and about with you, then please do let us know. And we mentioned about the training, so please do get in touch if there's any training needs there. What I wanted to do was just to end, because when we talk about postural seating, it can become quite, sometimes we can take the mood down a bit when we give these stats and figures about the need for postural care and some of the mortality rates that are associated with that. And of course, we have to be serious, but I just wanted to show you a quick video of when we get things right and how it can impact on daily life and really change someone's outlook. So hopefully this will play and you'll be able to hear.
Look at that, Paul. Oh, your plant's gonna do that. Lovely, Paul.
What do you think, my friend? Did you like it?
Is that cool? Eh? Oh, Paul, I'm jealous.
So just to lighten the mood a bit there, when we get it right, we can really transform people's lives. So you can see the image there, offering somebody alternative seating for comfort, of course, for compliance, but ultimately quality of life, and making sure that we achieve our clinical benefits and clinical objectives alongside that. Okay. Hopefully we're back on the screen now. And what we can do is just introduce a case study. And when we can run through the process behind selecting chairs, that assessment process, and then how we work our way through different chair functions to come up with the right seating solution. So we've got Tom, 81-year-old gentleman who resides in a nursing home, vascular dementia with associated frailty. Sadly now hoisted for all transfers because he's non-ambulant, doesn't have alternative seating. That's specialised for him within the home, only standard seating available, obviously complaining of discomfort, increased risk of pressure injuries. What they were seeing was increased episodes of respiratory illness as well, and infection, and then this vicious cycle of having to go back to bed and being confined to the four walls of his bedroom, and then reaching out to find alternative seating that address those specific postural challenges.
Right, so what I'll do is I'll quickly, because we don't have a lot of time left. Right?
Sorry, yeah, that's me rambling on.
I'll quickly run through some of the other chairs within the range, and we'll focus on the chair that we eventually provided for Tom. In terms of complexity, we're going from mild to moderate to complex to complex. As I said, I'll just quickly run through these, and Rebecca's already said, if you need more information on the particular product in mind that I've got with me, refer to the website. There's links, how-to videos, and a general overview of the chair, or every chair within the range.
Yeah, the clinical justification documents that I mentioned have got case studies in them as well, so you can see what type of individual or client group would use this form of seating and how it can help.
So this is a chair called the Smart Seat Pro, a tilt in space chair with back angle recline, seat width, seat depth, elevating leg rest, and an angle adjustable foot plate. I'm not going to go into a great deal of depth on this, but perhaps I'll focus on some of the features, if you like, that almost kind of disqualified it from being the most appropriate chair for Tom. It was just a little bit too complex. Part of the triage pre-assessment, we would have a conversation with you or with Tom's carers to see its clinical requirements and postural care needs. So tilt in space is a definite plus that would have suited Tom. Tilt in space is posture neutral. The back to seat angle remains fixed. Helps with fatigue management and pelvic stability. That was good. Seat width and the seat depth again for pelvic stability. Yeah, plus. Foot plate and leg rest. Articulating leg rest with an angle adjustable foot plate again would have worked for Tom. There's the kyphosis, which we could have helped manage with the adjustable back system, but overly complex for Tom's requirements, really.
Especially in the nursing home environment as well.
Again, we've not used the word holistic.
No, I know.
This is the first time.
Record for us, I think.
So holistically, environmentally, and the carer input to this chair would have been overly complex for Tom's requirements, and we try to keep things simple as possible as long as it's an effective solution for the person sitting in the chair. It was overly complex, but if you need more detail on this chair, we'll have a little look, or have a little look on the website.
Yeah, as Les said, in terms of only go as complex as you need it to go. When we talk about postural care, always go least restrictive option first. And when we think about the care plan as well, making sure it's as easy to follow.
This chair's called the HydraFlex. Again, a tilt in space chair with back angle recline. Different options for lateral support in the back of the chair. All the chairs with me today have pressure care built in. It's our water cell technology, medium to high, but we do stress that that just forms part of a system approach to pressure care. So it's not just the surface you're sitting on, it's how you sit on that surface as well, with pelvic stability and the pelvis in the neutral position.
And there's lots of stuff on the website again. If you wanted the justification for water cell technology, we've got independent evaluations, and that's published in the journal Tissue Viability. So again, if check the website, or maybe Kim can give the link for those clinical evaluations if you need to justify water cell, if you want to read more about water cell technology and how it integrates into the seating system.
Potential plus point for Tom with this chair though was the articulating headrest or back. That would have helped with the kyphosis. Is a fixed kyphosis, so where we can bring Tom back into the chair, we bring the support service out to help manage that deformity. I won't say too much more about this chair. We're fast running out of time, aren't we? This was a potential for Tom though. I'll skip to the hydro tilt.
What we find, just to say about the HydraFlex, what we find is that's often quite helpful for those who are still doing standing transfers as well, isn't it?
Yeah.
The seat height seems to work quite well for individual. I mean, Tom was fully hoisted and non-ambulant now, so that wasn't a key factor for him. But just to be mindful that if you'd ever had to work with individuals who were still ambulant, still doing standing transfers, then the HydraFlex, we've had good success, haven't we, with the HydraFlex with standing.
Moving on to the hydro tilt in space only on this chair, which sounds like a negative, but I look at that to me as a positive. It's against a less complex chair. Again, we've got seat width adjustment, changing the saddle arm, same as we would have done with the HydraFlex. We've got seat depth adjustment. Again, if you need to know how to adjust these chairs, go to the website, you'll see the how-to videos. Just quickly as well, you may be working with community loan store setting where you're looking to reissue a chair. If you want to reissue a CareFlex chair, the process is quite straightforward. Key tip to take away today would be to look for the serial number. You can just about see the little silver label on the back of the chair there. All these chairs are Class 1 medical devices, and as such, we need to provide a unique serial number for each chair. So you may have one of these chairs in your loan store, perhaps in your care home. Doesn't quite work for your client, or you need to assess the potential for it to work for your client. Supply us with a serial number, we give you the exact specification of the chair. So you may not be au fait with the hydro tilt, and you may be looking for a chair with tilt in space and back angle recline. We can tell you that this chair doesn't have back angle recline. From the serial number, I'll be able to tell you it's a manual chair. We do powered chairs as well. It's a 450 or a 45 centimeter seat width. So if you're looking for a chair for a client who's 55 centimeters, this chair doesn't have the capacity to meet that requirement. Could be though that you're looking for a chair with a narrower seat width. This chair does meet that potential requirement. We just need to change the arms on the chair. I'm flying through this.
Yeah, it's good. No, what I do want to say though, because Les also mentioned tilt and space and back angle recline, and differentiated between them both. If you're new to seating and those are terms that you're not aware of, we've got a good leaflet on back angle recline and tilt space. How are they different, and but more importantly, how to use them safely and appropriately, because they're not going to be safe and appropriate for everyone. Tilt in space, if somebody has aphasia, if they use a trade communicate PEC system, if they have catheters, then we need to be mindful of that. And back angle recline, Les said that obviously the hydro tilt doesn't come with back angle recline, which might sound like a negative, but actually if that individual cannot tolerate back angle recline, if they've got tonal changes, spasticity is a big one, isn't it? What we can see is if we open up the hip angle, we can see that tone shoot through the roof. So actually back angle recline isn't suitable for them. So the hydro tilt will be perfect because nobody can adjust it inadvertently. And again, that leaflet, if that's something that will be helpful, then ask for that in the chat function, because it really does show you when we should and shouldn't use tilt space and back angle recline.
So just coming back to the hydro tilt, to me, as a seating assessor, when I read Tom's postural requirements and postural care needs, this was the chair that was flagging for me. I'm thinking hydro tilt works well in the nursing home, care home setting, a nice simple chair, very comfortable chair. It's got the ability to be adjusted to meet Tom's need and to provide pelvic stability. But there's always a but, isn't there? Whenever we hoisted Tom into the chair, and we got hands on to make sure the pelvis was in a neutral position, there was a little gap at the back of the chair. We tried and tried again. What we realized was Tom didn't have the range in the hip to sit at the fixed angle that the hydro tilt has. So we had to look at another chair. So there's only one chair left. It's a bit of a giveaway. It's called the multi-adjust, tilt in space with back angle recline, with pressure care, seat width, seat depth adjustment, angle adjustable foot plate, with a negative angle leg rest. Now all the chairs have a negative angle leg rest as well, by the way, I haven't mentioned that. So where you have somebody with a contracture, it'll accommodate that person's posture.
There are tailored solutions as well. So even if somebody has an extreme contracture that goes beyond that minus 25 degrees, then some of the chairs can offer tailored solutions for that as well, can't they? Yeah,
tailored solutions. We saw a couple of images in Rebecca's presentation there, one with a lady with different ranges of movement in either knee. Tailored solution is a bespoke component of a CareFlex chair. I'm just looking, everything with me today is standard off the shelf, but we do have the capacity to make a bespoke adaptation to a chair. Again, if you want to go to the website and look that up, you'll see some indications of what we can do.
Yeah, really basic things from altering the cushions to stitching in the headrest to differentiate side to significant modifications to the chair frame itself.
So coming back to Tom, it left us with two potential chairs, either the HydroFlex or the multi-adjust. And this is where we come back to comfort and practicality.
And holistic.
Holistic, yeah, that's the second time we use that word. Tom just found the multi-adjust more comfortable. Couldn't really articulate why that was, but you know, the carers were saying he just found the chair a little bit more comfortable. And comfort is key for us, as Rebecca's already said. It's really important. You know, one of the big drivers was to help Tom remain social and maintain to stay,
Engagement.
with his peer group,
Mhm.
to engage with people. That was a key thing, and we wanted him to sit in the chair for as long as practically possible.
And comfort is entirely subjective. I think we forget that sometimes. It's completely, even though we might not think something's comfortable to an individual, it might be what's comfortable for them.
And what was helpful as well for the care home setting, is the multi-adjust is just that, it's a multi-adjustable chair. If you like, the HydraFlex is a chair from a slightly different generation, so let's call this generation 1, generation 2. The HydraFlex will adjust the seat width, we change the arms, we change the back. The seat width depth on all our chairs is adjustable, that goes without saying, but we need additional components to adjust the seat width and the back width.
More of an individualised prescription.
Yeah.
Whereas obviously when we talk about cost effectiveness as well, this nursing home particularly wanted a chair that had the potential to be used and recycled.
So that left us with the multi-adjust, tilt and space, back angle recline, elevating leg rest, angle adjustable foot plate. The way that we adjust this chair is loosen the front and the back. And I can just move the, loosen it off. You can move the arm in and out over the seat base.
And this is really good as well when we think about, even though this wasn't really applicable to Tom, when we spoke about wind sweeping earlier, so we can do that independent, so front and back, left to right. So we can have some tailoring there for thigh alignment as well to support if we can't, to accommodate if we can't correct. Did you want to pull the arm off?
Yeah.
Making sure.
We've arm back adjustment as well.
Yeah.
I was just going to recover that in a tick. Just going to show you how seat depth works, and it's very similar on all CareFlex chairs. There's a little lever at the back of the chair here. Okay, you can just see it highlighted against my hand. I hold that down, the brakes on. I can bring the back to me to increase the seat depth, and away from me to decrease the seat depth. Very similar mechanism on all CareFlex chairs.
And if I be your model there, so what we'll show, because we spoke about how important it was to get the basics right, which is often overlooked. It doesn't need to be overly complex. We have to get the basics right first. When we talk about seat depth, especially if it's too long, which is really difficult for me to make it too long. And then I'll show you, because when we said about postural challenges, there might not be any intrinsic cause for it, and actually it could be something as basic as the chair setup and something that isn't addressed. So if we work with an individual who doesn't have any damage to body systems, I've got full range of movement in my hips and knees. But what's happening is I can't quite bend my knees over the edge of the cushion. So to be able to make myself comfortable, so the moment is digging into my calves. Or what I need to do to get comfortable is go into that posterior tilt. So suddenly we've got this gap behind and causing this posterior tilt and creating this destructive posture just from the basics. Yeah, just causing this posterior tilt and this significant postural challenge just from the basic setup of the chair being incorrect and not addressed. So that's why it's really, really key. Seat depth, seat width, and critical to that seating prescription. I should wear bright yellow trousers, you can see.
The contrast.
Yeah.
Colour coordinated. Yeah, so that was tilt and space and seat depth. Back angle recline.
Helpfully labelled as well. So I
Yeah.
love that bit.
EAR and TIS, tilt and space and back angle recline. And just for continuity, tilt and space is always top right on a CareFlex chair. So tilt and space, squeeze, hold, adjust, release, wherever is most appropriate. Back angle recline, we've engineered so that it needs a little bit more thought before you actuate or move the component. So it's a double lock.
Yeah, I think that's one tip, kind of one highlight to take away from today is that you appreciate that back angle recline is probably the most inappropriately used function on a chair.
Because with having tilt and space and back angle recline on the chair, 2 levers in the back of the chair, it's kind of instinctive just to come to the back of the chair and squeeze both like a push bike. The double lock on this prevents that from happening. So to actuate, or to activate is the word I'm trying to use, to activate back angle recline, there's a little lock there which I do release, squeeze, adjust, and it was only slightly for Tom, but it enabled us to get him right back in the chair to help with that pelvic stability. When I release, you'll hear that click lock. Okay.
We have disconnected them in the past as well and hidden them away and done all sorts if you are worried about compliance with the care plan.
Lateral support, we just needed to keep Tom in a midline. The adjustability of this chair means that we can easily click away the back and change that either for a a waterfall back, or a flat back. With a flat back, we often use an adjustable lateral. Pop that in. So if you've got somebody who needs something a little bit more specific, or perhaps somebody who's got an asymmetric posture,
Yeah, if we need that multi-point support.
we can adjust the lateral up and down and offset at different heights.
Yeah, on both sides.
And in and out as well. But Tom didn't need that. He wasn't that complex. Plus, coming back to comfort, he wasn't really accommodating that lateral in underneath the arm. So
The combos is a really good option because it offers that prompting the central position. But if somebody has good trunk alignment and not necessarily have the scoliosis that Les has mentioned, and maybe it's just generalized weakness that's causing it, it can just offer that bit of comfort and prompt.
So the little clips here, you can see if I move the chair around. There are pre-drilled holes in the back of the chair. These just clip into place. Pretty much, well, it's almost the same spec that we've provided for Tom, but I just want to show you something which is fairly new. Just show you. Oops. Because we seem to see more and more semi-ambulant individuals, those who can stand to walk with assistance. So as an option for this chair now, I've got, see that better there, this chamfered arm, which allows access with stand assist, steady style of hoist. It allows you to get the paddle arm in a little bit closer. This is a standard full width or full length arm, but just to show you the difference. So Tom didn't need this because he's fully hoisted. So the exact spec Tom would have been.
Just to touch on that while Les is switching them over, when we talk about hoisting, those removable arms, even if somebody doesn't do side transfers, actually for hoisting, it makes it so much easier to get slings in and out without disrupting the posture. So what we find is somebody hoists into this perfect position and then wriggling, trying to get the sling out. If it's not an in situ sling, that can actually help to get the sling out and positioned appropriately.
I think that's it. I think we just covered most things. We've covered comfort, pelvic stability, fatigue management.
Yeah.
Infection control is something that's key as well in a care home setting. So all the covers on the chairs are antimicrobial. Pressure care. Again, if you want to see the water cell seat cushion in a bit more depth, pop along to the website and have a little look there.
That's a lot of information in an hour.
It is. I'm out of breath now. I need a seat, and we've got plenty of them. I'm going to sit down in a minute. So that brings us to a close for the presentation. Do we have any questions, Kim?
I think I've answered quite a lot in the chat this morning. There was a question about whether we have a bariatric offering.
We have an extra large or an extra wide hydro tilt chair that goes up to a 26-inch seat width and a 35 stone weight limit.
I've also
What-
provided the link to that chair on the website as well.
And we've not mentioned it today, but we also have a rise and recline range as well. And we've access to bariatric products as part of that range.
And I think that's it. Just that all of the clinical justifications, as you said, and the seating assessment forms can be found off for each of the chairs if you go to the website and go to the download section.
What we'll do as well when because I know there's a lot of information to get through on the presentation, I'll put in some slides as well when we share it, so you can see the seating solutions. Because I know we've gone through the chairs, but you might have forgotten what particular postural challenge did what. So I'll just add in a slide to give you just an idea of the seating solutions that can help for those individual postural challenges.
Okie dokie. Well, if that's a wrap, we'll just say goodbye and we'll see you in a month's time for our next webinar. I'm sure Kim will be sending you updates of what that is and when it is, and the times and the dates and the registration details.
Yeah, that's all been posted to the chat as well.
That's lovely.
Brilliant.
Okay, well, thank you very much.
Thank you
and
very
hopefully
much.
we'll see you all soon sometime. Thank you.
Have a good day. Bye.
Bye-bye.